So we decided to go with eTriage because we wanted to have that flexibility to adapt the information that we were collecting, and we also really wanted to focus on the relationship between us and the team so that we could respond to any clinical need, we could make tweaks as we felt necessary, and we could really be confident in the clinical work underpinning the booking process. We also, with our triage nurses, wanted to show them how we were basically providing them more information of what was going on in the waiting room. So they were still triaging the patients, but they were having more than one sentence to go on as to what the patient's problems were. And they were having the patient's own words and own answers to those key questions about chest pain or abdominal pain to ensure them that all the red flags had been checked and to identify people that needed triage earlier. We're increasingly asked to collect injury information, patient demographics, and the patients are the best people to enter that data. That information is then reliable, it's accurate, and we had to be confident from a technical and from a medical point of view that we were happy with what we were doing. We made sure that we had a system that was collecting the SNOMED data, that was putting it through to the ECDS, that we were getting the correct information through into our system, and we could work through it through triage. It was immensely helpful to us during COVID because it enabled us to have front door messaging that directed patients to safe areas to prevent red patients going to green, and it really came into its fore as we were redirecting patients around the department. I'm pretty confident both ways with the safety of that system, as it really helps standardise the triage process, and it helps give us that kind of backup and underpinning of the clinical questions we've asked. We're still ensuring that we're asking all the correct questions for chest pain, for abdominal pain, that we're covering all the red flags. Much more robust process than relying on the triage nurse writing every negative finding down. So from a governance point of view, it's just much safer and more robust. And now it's pretty much an integral part of what we do. So I know that the team find it immensely helpful at times of pressure.